topic of discussion is cholelithiasis and cholecystitis. First of all, what is cholelithiasis? It is basically the gallstones, the stones present in the gallbladder. And what is cholecystitis? It is the inflammation of the gallbladder. There are two types of the gallstones, pigmented and non-pigmented. The pigmented gallstones are caused by the destruction of RBCs leading to production of supersaturated bile with bilirubin. This bilirubin precipitates in the gallbladder and leads to the formation of gallstones that are pigmented. Other is non-pigmented. The non-pigmented gallstones are basically cholesterol deposits in the stones that are supersaturated in the island of bile. The factors that leads to the formation of gallstones are known as 5F. You need to remember 5F. First F shows fertile. The female could be fertile. Second is the female. Third F stands for fatty. Fourth F stands for 40, means the patient age greater than 40 years. And other F stands for fairness of the color. The persons with fair color are prone to the formation of gallstones. Next, we should seek how the gallstones cause cholecystitis. When the gallstones get blocked, the bile duct or the cystic duct, this leads to the stasis of bile in the gallbladder, and it leads ultimately to the activation of the immune system. Cytokines are raised, neutrophils are attracted, and this leads to the inflammation of the mucosa. It is known as cholecystitis. There are two types of cholecystitis, the calculous cholecystitis and decalculous cholecystitis. Calculous cholecystitis, as I already had explained, caused by the gallstones. Acalculous cholecystitis is basically caused by non-calculous. The causes are not a gallstone. What could be the causes then? Yes, the causes are trauma, critical illness, sepsis, or any injury to the vascular structure or the vasculopathy itself. Any bacterial or fungal infection that ascends through the bile duct, then the cystic duct, or also to the enteroheaptic circulation. It leads to the formation of acalculous cholecystitis. We perform most of the time cholecystectomy. That could be open or laproscopic. Nowadays, laproscopic is very common and it has most advantages: less scar, less manipulation of the tissue. Patient stay at the hospital is very reduced, and the main factor is it is economical also. Open cholecystectomy basically has complications like it has got scar, it has led to the formation of adhesions after cholecystectomy. The other reason why we should seek surgery is that when the stones are multiple, because the diameter of CBD is less than the size of the CBD, which is either 5 millimeter or less than 5 millimeter, it can slip into the CBD, it can block, it can strangle rather than pull out water. This leads to the formation of the cholangitis, then cholecystitis also. It is also known as cholelithiasis, the stone in the CBD. So always get surgical consultation when you've got multiple stones or the stone size is less than the size of the CBD. The reason to operate is that I mentioned, when the stone gets stuck in the CBD, you have got many complications. You have to undergo ERCP and then stenting, which already has its own curse, its own disadvantages. The reason I'm here to discuss about the cholelithiasis is that it is very common. Approximately 10 patients out of the 20 who perform the list are suffering from cholelithiasis, and most of them are females, as they are prone to the formation of gallstones. Avoid fatty meals, avoid oily things, do not do fasting for longer periods of time, drink plenty of water, control your cholesterol levels, do daily exercises, eat fresh fruits and vegetables, avoid red meat, and also maintain your BMI, which is very important in the contribution of gallstone formation. To keep yourself healthy, fit, and mobile.